Welcome to the Limbic System in Life and Work, video presentation number 2 by Matthew Lewis. This presentation is for consideration for PSY 7510 Biological Basis for Behavior. University of Arizona Global Campus, taught by Dr. Heidi King. We are going to be exploring the limbic system. The term limbic comes from the Latin for edge or border, or, particularly in medical terminology, a border of an anatomical component. Dr. Paul Broca coined the term based on its physical location in the brain, sandwiched between two functionally different components. The limbic system is not a distinct anatomical area of the brain but one whose various parts are united by its function, explicitly regulating emotions, memory, motivation, and behavior. The boundaries of the system are functional rather than anatomic. For simplicity, we will keep our discussion to just a few that are universally considered to be a part of the limbic system. The prefrontal cortex refers to the cerebrum section, located right behind the eyes and the forehead. The prefrontal cortex is distinct since it is not just a sensory, or motor feature of the brain but receives inputs from several cortex areas to process information. The damage to the prefrontal cortex may be caused by various factors, including traumatic brain injury, and neurodegenerative diseases. Frontal lobe syndrome is the general term, used to denote the clinical syndrome related to the damage and impairment function of the prefrontal cortex. The thalamus involves the combined diencephalon gray matter structure, situated close to the brain center, even though there are some regions formed by white matter or axons. Thalamus is formed by a chain of nuclei that serve to relay various sensory signals. Hypothalamus is separated by the anterior fornix horns and littoral, medial, and media regions and by the coronal plane. From a structural perspective, the hypothalamus is made up of a gray matter collection of neurons that organize in nuclei and a white matter substance made up of myelinated nerve fibers. The traumatic head injury affects the thalamus, and can result in sensory and cognitive side effects. Thalamus damage in individuals with severe or moderate brain trauma leads to neuronal loss within the dorsal medial nucleus and ventral posterior nucleus. The damage to the hypothalamus leads to dysfunctions, with significant effects on the hypothalamic pituitary adrenal axis, and hypothalamic inhibitory is interfered with, causing the pituitary hypersecretion with its clinical exhibitions. Let us move to the existence of emotional memory in these structures that lie in lower areas, such as the subcortex in the brainstem. Overall, they all contribute to higher cognitive processes of emotion memory and behavior. For example, suppose one comes across a cat that starts hissing at you. In that case, they will likely feel an immediate rush of fear. This is because their amygdala has judged this situation to be dangerous and has activated parts of your body such as the sympathetic nervous system and its fight or flight response to take action. If the hippocampus is damaged by injury or disease, it can influence a person's memories and their ability to form new memories. Someone who sustains bilateral damage to their hippocampus will often experience a profound inability to form novel emotional memories. The hippocampus is also one of the early structures to show evidence of trauma and disorders like Alzheimer's, in which loss of memory plays a key role. Hippocampus damage can primarily affect spatial memory or the ability to recall directions and locations. A disorder that prominently details impaired memory formation, including both anterograde amnesia or an inability to form new memories and retrograde amnesia or a loss of previously formed memories. All of us have the ability to remember information for a short amount of time, such as needing to retain a phone number in mind only long enough to dial it. In contrast, if the information is tagged as important. An example, if it is the phone number of someone that we are very attracted to, then we will be more likely to commit the information to long-term memory. The amygdala is directly involved in the formation of long-term memory and decision-making. Indeed, Any situation in which we are emotionally activated is likely to be remembered strongly so that we can make different decisions in the future. You can remember the function of the amygdala by thinking of it as the memory marker to associate it with our emotional response to certain stimuli. Structures like the amygdala lie on the inner side of the temporal cortex and are involved in the formation of memories. The hippocampus is involved in consolidating short-term memories into long-term memories. The amygdala helps control our fear response, but it also plays a crucial role in many other cognitive functions. Researchers have found that lesions on the amygdala can cause hypervigilance in response to perceived fear in others. In other words, the person with amygdala damage becomes sensitive to minor facial expressions, interpreting them as a sign of a possible threat. Since these dangers are not real, the person usually is in a constant state of anxiety. However, unlike patients with paranoia, a hypervigilant person understands there is no actual threat. They cannot control their physical response, and anxiety can be damaging in other ways. Damage to the amygdala can cause serious problems, such as poor decision-making and impaired emotional memories. Fortunately, with the right combination of therapy and medication, you can reduce the symptoms of amygdala damage and get back control of your life. The cingulate gyrus is an arch-shaped convolution situated just above the corpus callosum. The frontal portion is termed the anterior cingulate gyrus. A component of the limbic system is involved in sampling emotions and behavior control. The anterior cingulate cortex is often considered to be a part of the limbic system. In particular, it seems to play a large role in error recognition. This can involve many different kinds of errors, whether it is a simple mistake like seeing a word that has been misspelled or a moral wrong such as seeing somebody break into another person's house. The last part of the limbic system we will talk about is the nucleus accumbens in particular. The nucleus accumbens appears to play a key role in governing motivation and reward activities such as eating food, having sex, earning money, and using addictive drugs like cocaine or heroin have direct effects on the nucleus accumbens, leading to pleasurable feelings that increase the chance that someone will engage in more of that same behavior in the future. While rewarding-oriented behavior is not an end of itself pathological, social consequences revolve around the overall health of the limbic system, where this system seems to have loose borders within the brain. Damage to parts of the limbic system is shown in our sensory system. Damage to the amygdala increases irritability and aggression. Damage to the hippocampus leads to severe memory impairment. Damage to the thalamus and hypothalamus can raise problems with one's bodily organs. These damages lead to emotional or mental impairments to humans living normal lives and creating healthy interactions. This knowledge also helps us understand the health burden to avoid long-term damage.